Jillian has struggled with allergies her whole life. She's desperate for a cure.
Allergies affect my life in so many ways. I go through a lot of tissues during the day. I'm constantly blowing my nose. Sorry. Sleeping is difficult pretty much every night. I have a hard time breathing through my nose.
When she's trying to sleep at night, she'll make some gasping sounds.
It's beyond frustrating, just very annoying. Several things trigger my allergies. Sometimes it's the things in the air or when I'm cleaning with the stronger household cleaners. Sometimes I wish I lived in a bubble so I could just avoid allergies altogether. If my boyfriend Kirk and I go outside, I get itchy, runny eyes, my throat swells up. Best case scenario, I'm just hoping to breathe easier. I just don't want to be sick as much. Excuse me.
Jillian and her doctor, Dr. Schwimmer, are here today. Welcome to both of you.
Thank you.
So, Dr. Schwimmer, truly a possible quick cure?
Yeah, this is remarkable. You'll be amazed. This really is a 5-minute solution to nasal allergy symptoms.
Well, up next, Jillian's sinus problems may be cured once and for all when Dr. Schwimmer shows us this cutting-edge procedure. We're doing it right on our stage. Before the break, you met Jillian. She's had nasal allergies and congestion forever, and she's all ready for her own 5-minute cure. We're here with her physician, Dr. Schwimmer, as well as his colleague, Dr. Goldwyn from the Southern Medical Group in Sacramento, California. Welcome to all of you.
Thank you.
And Jillian, we're talking before the break. 24 hours a day, 7 days a week.
Definitely.
Congested.
All the time.
and we're going to talk about this really unique new procedure, but let's also touch upon, she's on nasal steroids. She's on everything you can be on, but still has no relief.
Absolutely. And so the goal here is to significantly reduce her nasal allergy symptoms. The congestion, the pressure, the dripping, the postnasal drainage, and the turbinate ablation is remarkably effective at relieving those symptoms.
Because we're basically creating a bigger passageway.
Exactly. We're going to do two things. We're actually going to make the turbinate, the sidewall structure in the nose, smaller, and we're also going to reduce the reactivity of that tissue. So there's going to be less of it, and the tissue that's there will swell less in response to allergies.
And we have an animation here I want you to describe to us.
Absolutely. So what we're going to be looking at is inside the nose, and on the outside of the nose is a structure, a normal structure called the turbinate. And if you put your pinky inside your nose and you feel the bump on the outside, that's the turbinate. And what we're going to do is shrink that by putting a probe inside and using radio frequency energy to reduce that tissue.
You ready?
So ready.
And you're all numb.
Yes.
So Dr. Goldwyn is going to do the honors, and this is truly amazing because it's such a quick procedure.
It's brilliant. It's a couple of minutes, and for most people it yields tremendous symptomatic relief.
So Dr. Goldwyn,
this is the probe, and the active end is right at the tip. So when you place the probe in the nose, there's no mucosal injury. There's a lot of techniques cause burning of the actual tissue outside the nose. This takes care of the tissue inside the nose. There's less side effects.
Okay.
All right. Sweetie, ready? Mm-hmm. Okay, so over towards me, just a touch.
And Dr. Schwimmer, this is a procedure that would cost how much if you were to...
At the Snoring Center, we charge $1,500 for the turbinate ablation. Most of our patients are able to obtain insurance reimbursement for their out-of-network benefits. So it's not terribly expensive, and for a lot of people, it allows them to significantly reduce the cost of their allergy medications. A lot of our patients are, spending $50, $60, $70 a month on allergy meds.
Right. And the important point we want to make, if you're an allergy sufferer in the audience or at home, is this doesn't stop allergies from happening, it just controls the symptoms.
That's exactly right. This does not change the fact that patients have allergies, but it does effectively reduce nasal allergy symptoms, and that's what makes so many people so miserable.
And the people who have a benefit from this will have a lifelong benefit in most cases?
We measure the benefit in years.
Unbelievable.
Yeah, it's incredible. It's just a couple of minutes, and it really works well.
Feeling all right?
We've been doing this for about 8 years, and we've not seen a relapse yet, so we don't know if it's permanent, but certainly the relief lasts many years.
Pressure.
And we're not really cooking the tissue.
That's right. It's called coblation, which stands for cold ablation. So it is not a thermal injury, so you don't have crusting and pain and bleeding afterwards. It's the use of radio frequency, and so it's a temperature-controlled injury.
And the difference is, typically when we use heat, you get that smell of burnt tissue. With this procedure, nothing like that.
Exactly. And also the problem with heat is that you don't only damage the tissue that you want to damage, you damage a bunch of the adjacent tissue.
And that's it.
That's it.
5 minutes or less. How do you feel?
Great. So far, so good.
Thank you so much.
Thank you.
Dr. Goldman, thank you. Thank you, Dr. Schwimmer.
That's my pleasure. Thank you, Travis.
Wish you the best of luck.
Thank you. I
You're in good
appreciate
hands.
it.